we'll study the role of Western diet, obesity, on the interaction between the tumor cells or the initiated cells and the host stroma. And in fact, we'll study how those conditions affect the desmoplasia, the fibrogenesis in pancreatic cancer development. And for our program project grant, we're going to use an animal model. Now, when we fed our mice, the wild-type mice and our mutant mice, either the control diet or our high-fat caloric diet, what we found, and that is very important, that under the high-fat, high-caloric diet, the animals gained significantly more weight over time. So as you can see here, after 14 weeks of feeding, the control mice, the mice on the control diet, had an increase in weight of about 6 grams, 7 grams, while the mice on the high-fat diet gained about 16, 17 grams of weight, which was highly significant. So that is very important because it resembles what we're trying to resemble in the human situation, that humans who eat a Western diet are getting obese. We see very similar in our animal model. Now, if we look at some cytokines in the plasma and look at metabolic disturbances in animals fed the high-fat, high-caloric diet, what we found is animals under the high-fat diet compared to animals under the control diet had much higher insulin levels. So they developed hyper-insulinemia. At the same time, they had significantly elevated levels of IGF-1. They are hyperglycemic, elevated levels of glucose, which was significant. And they had very significant elevation in leptin, which is an adipokine. So all those results we found in our animal model really very closely resemble what is found in obese people who eat a Western-style diet and who develop insulin resistance and hyperinsulinemia. So we were quite excited and happy about that animal model, which we think is very important that it resembles as closely as possible the human situation. Now, looking in the pancreas, here you see some representative images of how the pancreas of mice looks like, which were fed the high-fat, high-caloric diet. And those are images from mutant mice fed the high-fat, high-caloric diet. And as you can see in the overview, there's virtually a loss of normal acinar cell tissue. What you can see here is inflammatory fibrogenesis here, desmoplastic reaction. And you see here not acinar cells, but what we call Pannon lesions or metaplastic lesions. Some of them we would count and quantify as Pannon lesions. And here are some higher magnification. You see here are Pannon lesions, early Pannon lesions, more advanced Pannon lesions, and that maybe count for a Pannon 3 lesions. Again, you see here the desmoplastic reaction surrounding these Pannon lesions. So also on the histological level, if you look at the pancreas under the microscope, what we see is very similar to what we expect to see in humans under these conditions. And what we found is when we quantify now these lesions, that mutant mice which were fed the high-fat, high-caloric diet, there was a shift towards more advanced Pannon lesions. So the blue bars show you the distributions of Pannon lesions in mutant mice under the control diet. And most of the pancreatic ducts were normal or had very early Pannon lesions after the 14 months of feeding. And only very few had more advanced lesions. Now, when these mutant mice were fed the high-fat, high-caloric diet, as I said, there was a shift towards the more advanced lesions. We see significantly more Pannon 2s and Pannon 3 lesions, and that's just a quantification of our results. At that point, we didn't see yet invasive pancreatic cancer, but what we expect is if we continue the studies for a longer time point, that mice which are fed the high-fat, high-caloric diet most likely will develop invasive lesions earlier. With that, I end, and thank you very much.